Do you remember the lumberjack with the deformed toe?
Mm-hmm.
Paul Bunyan.
Yeah, so we're talking about bunions. Someone literally asked, is that really his name?
I couldn't remember, it sounded right.
He didn't really exist. So we're talking about bunions. So what is a bunion? Bunion also has a Harry Potter spell name, abductohallux valgus. So what's that mean? Your toe is abducted. This is your hallux, right? And valgus means that it's kind of positioned in. So it's a toe that's positioned in. You've all seen a bunion. Your grandma probably had one. She said it was genetic. It's not genetic. It's a bunch of different stuff, but that usually comes from all sorts of stuff. Like when I don't toe off appropriately, I start spinning around the toe. Pretty soon I start to create some bony formation. Boom, you got a bunion.
Bunions are typically...
Oh, you can't, no. Keep going.
Bunions are typically treated with orthotics or different devices like a bunion booty that pulls that big toe back over into midline, or surgery.
So what are better options for treatment? Well, if you have a bunion, right, we said it's kind of pulled over away from midline. So if it's still reducible, so what that means is I'm still able to move that bunion back to normal, you want to use something like, boom, Correct Toes. We're sponsored by, no, we're not sponsored by Correct Toes. But some sort of spacer. You could put a pickle in there in your bunion, right? It's a bun and an onion sandwich now.
Don't put my joke was bad.
Don't put that in there. But you need something to space it out, because then it creates a better approximation across that joint to go back through toe off. So what are some treatment options besides just spacing it out? Well, we may need to work on the mobility of your foot, because there's a good chance that the reason you didn't move around that big toe is it wasn't mobile enough. And it's not just about big toe mobility, it's whole foot. So if your foot cannot go through proper supination, pronation, that's a big part of what we need to get to happen. So foot mobility drills, all sorts of stuff. Rolling a lacrosse ball, inversion, eversions, ankle dorsiflexion drills like our triplanar, what is it? Triplanar ankle dorsiflexion magical drill for the foot. I think that's the whole name, something like that.
Do we have an acronym?
I don't know. So what do we do after we treat it?
We want to load it. So we want to do things like squats and deadlifts and lunges, all exercises that we probably already do, but we want to really focus on creating that tripod effect of the foot and moving through the big toe.
The camera's on a tripod.
Oh.